Ear cropping is an elective surgical procedure that has been traditionally performed on certain dog breeds. It involves the removal of the flappy portion of the ear, followed by taping to train the ear cartilage into the desired position. While it was historically implemented for various reasons such as improving hearing, preventing ear infections, and for intimidation or protection purposes, these justifications have been mostly disproven or are no longer applicable today. This video aims to provide a comprehensive understanding of ear cropping, including its historical context, controversies, and legal considerations. Ear cropping is a surgical procedure involving the removal of a portion or the entirety of a dog's ear flap, often followed by taping to shape the cartilage into a desired form. This practice is prevalent in approximately 20 dog breeds, including Dobermans, Great Danes, Boxers, and Schnauzers, among others. While historically implemented for practical purposes such as hunting, fighting, and working roles, ear cropping is now primarily considered a cosmetic procedure. In some breeds, ear cropping is done to adhere to established breed standards, emphasizing a specific aesthetic appearance. Some owners and breeders believe that cropped ears enhance the overall appearance of certain breeds, contributing to a distinctive and regal look. Many argue that ear cropping is an unnecessary and potentially painful procedure, raising ethical questions about altering an animal's appearance for cosmetic reasons. Ear cropping involves surgical risks and requires proper aftercare. The procedure can cause pain, and complications may include infection, prolonged healing, or adverse reactions. Natural ears are seen by many as a reflection of the dog's true and unaltered appearance, allowing the breed's natural characteristics to shine. Opting for natural ears aligns with an ethical standpoint that values the well-being of the animal and avoids unnecessary surgical interventions. In some cases, adhering to breed standards without ear cropping may affect a dog's performance in conformation shows. Beauty standards are subjective, and opinions on the attractiveness of natural ears versus cropped ears can vary. Ear cropping was historically practiced in specific breeds such as Dobermans, Great Danes, Boxers, and Schnauzers. It was believed that cropping the ears would enhance hearing abilities, prevent ear infections, provide intimidation, and protect the dogs in certain roles such as hunting and fighting. However, these reasons have been debunked by studies and changing societal norms. It is now widely acknowledged that ear cropping does not improve hearing or decrease the likelihood of ear infections. Moreover, the use of dogs in hunting and fighting has decreased, making these justifications less relevant. The practice of ear cropping has become increasingly controversial in recent years. Many countries and breed associations have banned the procedure due to ethical concerns and the lack of medical necessity. For example, Germany, where some of the commonly cropped breeds originated, has implemented a ban on ear cropping. Despite this, the practice remains legal in the United States and Canada, although there have been legal battles in some states to outlaw it. The American Veterinary Medical Association does not support ear cropping for cosmetic purposes, highlighting the unnecessary risks involved in any surgical procedure. Nonetheless, the American Kennel Club and Canadian Kennel Club continue to allow registration and showing of cropped dogs. It is important to recognize that ear cropping is an elective and cosmetic procedure. As such, it is not necessary for the health or well-being of the dog. The surgery should only be performed by a qualified veterinarian to ensure the safety and proper care of the animal. Unfortunately, some individuals attempt to perform the procedure at home, using crude methods that can result in pain, trauma, infection, and even the loss of the entire ear. It is imperative to consider the risks associated with any surgery and thoroughly discuss them with a qualified veterinarian before making a decision. Ear cropping is typically performed between 8 to 12 weeks of age when puppies can safely undergo anesthesia. Waiting too long can result in the cartilage hardening and adopting its permanent shape, making the procedure more difficult or ineffective. After the surgery, special care and training are required to facilitate the proper formation and standing of the ears. Weekly bandage changes and close monitoring may be necessary, increasing the risk of ear infections during the healing process. It is also essential to have a clear understanding of the desired ear crop style before the procedure is performed, since it cannot be undone in most cases. While ear cropping is still offered by some veterinarians, it is crucial to find a qualified professional who prioritizes the animal's welfare and uses proper surgical techniques. These veterinarians aim to perform ear cropping with minimal pain and distress to the animal. It is recommended to conduct thorough research, seek multiple opinions, and consult with a trusted veterinarian to make an informed decision about the procedure. Ear cropping is a procedure that has historically been implemented in certain dog breeds for various reasons. However, many of these justifications have been disproven or are no longer relevant in today's context. The practice is now considered elective and cosmetic, and its legality varies across countries and breed associations. It is important to approach ear cropping with caution, considering the risks involved and the ethical concerns associated with this procedure. Responsible pet owners should prioritize the well-being and health of their dogs and have open discussions with qualified veterinarians before making any decisions regarding ear cropping.